Hi, I am Dr. Ramesh, Director of AV Hospital and Arka Anugraha Hospital. Now I wanted to say something about weight loss because most followed resolution or most promised resolution of a new year has always been to lose weight. And this has been going on for ages and that's not changed as yet. So there is so much that has come up. I have been involved in weight loss for very long time, and this is because I have been pioneering a lot of laparoscopic surgeries, and weight loss surgery in laparoscopy has become an extremely popular surgery. And I also have been fortunate to have done the first ever laparoscopic Roux-en-Y gastric bypass, which is the gold standard laparoscopic surgery for weight loss as well as for getting out of diabetes, and this we started 18 years ago. Now we always say ABC of weight loss is D and E, so that means diet and exercise. So we never say get any procedure done, go take some tablet. It's always about diet and exercise, and this has to be followed for a very long time. We should know our ideal weight, we should try to come to our ideal weight, and we also have to have some knowledge about the secrets of weight loss. Many people put on weight every time that they stop putting too much effort. It's very easy to lose 3 to 5 kgs and sometimes even up to 10 kgs. People lose weight by going to nature cure hospitals, going on a liquid diet, detoxifying, and after that when they come back to their original routine, they put on weight. And this is called a yo-yo phenomenon. And this yo-yo phenomenon happens especially if a person has crossed a limited weight. That is, if somebody is about 20 or 25 kgs more than his ideal weight, that is when the person starts getting into a yo-yo phenomenon every time he tries to lose weight. So first and foremost, we need to know what is our ideal weight. To know your ideal weight, you should know your body mass index, and that has been calculated by a formula. The formula is your weight in kgs divided by your height in meters by square. And when you do this, your ideal body weight should be between 18 and 23 BMI. If it is more than 23, then you are overweight. When it goes beyond 27.5, then you're supposed to be obese. And in obesity, we have level 1, level 2, level 3 obesity. Every 5 BMI, 27 to 32.5, you are class 1 obesity. From 32.5 to 37.5, you become class 2 obesity. And then beyond that, you get into class 3 or morbid obesity. When we talk about morbid obesity, it means that you have some comorbid conditions that you develop, because this amount of weight is going to bring you some problems, whether it is backache, diabetes, hypertension, increased cholesterol, heart problems, obstructive sleep apnea, and so many other things. So obesity becomes a mother of diseases. The easiest way to calculate your ideal weight approximately is by knowing your height in centimeters and subtracting it by 100. Supposing you're 5 feet in height, which is a standard height of all women in India, then 5 feet is 150 centimeters. So your ideal weight should be 150 minus 100, which is 50. So 50 kilograms should be your ideal weight. Probably it should be 1 or 2 kgs less than that, but then that is fine. So once you have calculated your ideal weight, you have to look at what is it that you have to lose. Supposing you're 100 kgs, you have another 50 kgs to lose. But then if you lose 10 or 20 or 30 kgs, you jump back and that is because we all have something called a set point. So your set point has been 100 kgs for quite some time, and it does not change, like your body temperature not changing, your heart rate not changing. So they are all stable. Your blood glucose level will be the same. So many blood parameters we do, everything will be the same. That is because the body tries to manage everything in a stable condition. This set point can be changed only if you lose about 80% of your excess weight and you are able to manage to stay in this weight for at least 9 months to 1 year. So supposing you are 5 feet in height and then your ideal weight is 50 kgs, but you are 100 kgs now, then in the 50 extra kgs you have to lose about 40 kgs, and after losing that you have to stay in that weight for a minimum of 9 months to 1 year, in which time the set point will change, and after that you may not put on weight unless you have some bad habits in your lifestyles and other things. So how do we lose weight? The first and foremost is the mind. The mind controls the body, and we need to get out of stress, get out of too much expectations, understand what is there in weight loss. So first is try to follow the biological clock. Sleep at the right time, sleep for enough time, eat at the right time, eat the right quantity each time, and listen to your body. These are some of the key things that will keep you tuned to the biological clock, and that will set a rhythm in your body. Apart from this, it's always better to try to stay without any stress. Stress causes mental hunger, and we try to eat too much and we try to eat too fast. And that is one of the main causes for putting on weight. Meditation is one of the best ways of trying to get out of stress. And then we also have many other things like yoga and pranayama, especially mudra pranayama, that will help us to lose weight. Exercise is something that is to be followed properly. We need to take some guidance from people if at all we are not losing weight, and we have to be consistent in whatever efforts we are putting. A minimum of 45 minutes to 1 hour is the least exercise that is expected from us to lose weight. Both diet and exercise has to go simultaneously, and that is how we are able to lose weight. Our expectations should not be losing too much weight in a short while. You should always plan to lose about 2 to 2.5 kgs every month, and keep doing this for the next 10 months or 12 months based on how heavy you are. And when you have these small expectations, and when you are consistent in your efforts, and this perseverance is kept up with a highly motivated mind, then you will be losing weight steadily, and that steady loss of weight, though gradual, is going to stay with you, and that is going to reduce your set point and prevent weight regain. Today we have a whole lot of technologies that are helping us, especially if we are not able to lose weight by just diet and exercise. Many people have a lot of knee pain, they have so many other problems due to which reason they cannot exercise. There are many people who cannot diet properly because they have acidity, they have so many other issues which is not allowing them to go on a proper diet. Then, are there any medicines? Is the first thing that every person will ask, because that's the easy way out. We have been trying a whole lot of tablets and medicines for the last 2 to 3 decades, but up to now we have not found any medicine that can actually cause permanent weight loss and significant weight loss. Most medicines cause only 5 to 10% weight loss, and most of this weight comes back as soon as you stop these medicines. There is one good news for 2023, and that is we are getting an injection that has been tested and proved to cause weight loss. This injection has to be taken once a week, and this has to be taken for a minimum of 52 weeks. And this is going to cause a weight loss of 10 to 15%. But then this is a very expensive medicine, and we still do not know whether it is going to cause permanent weight loss or whether there will be weight regain as soon as we stop this medicine. Most people feel that there is going to be weight regain as soon as the medicine is stopped, meaning we have to take it lifelong. We have several products in the market which promise good weight loss, and most of these cost between 1,500 and 3,000 per month. This is because it has been proved in the industry that when there is a medicine that costs this amount, a whole lot of people are going to buy it and use it. But still, we do not have anything that is causing significant weight loss permanently. Now, after medicine, what is there to lose weight? Now, the next best thing that we know of is a capsule that can be swallowed that becomes a balloon in your stomach and stays there and makes you lose weight. This is a latest invention by an Indian in the US, and all that you have to do is swallow this capsule. The capsule has a small tube that is connected to it, and it is still outside your mouth, and through that small tube they inflate the balloon, and once the balloon is inflated inside your stomach, the capsule disintegrates in 4 minutes, and after the capsule disintegrates, you have a plastic bag, empty plastic bag, and you get this plastic bag filled up with fluid. And once the fluid is filled up, you just pull out the tube, and it's the balloon or the bag stays inside your stomach. And in about 4 to 5 months, there is a closure stitch that is used to close the ball, and that stitch gets dissolved and the whole ball collapses, and it is passed out in the natural way in the motions. So in this 4 to 5 months, a person can lose about 10 to 15 kgs on an average. Still better, we have other balloons that can be inserted using an endoscope, and these balloons can be kept inside the stomach for up to 9 months to 1 year, and this causes a little more weight loss than the disintegrating balloon. If somebody wants to lose even more weight, then we have something called endoscopic sleeve gastroplasty. So in this procedure, we put in an endoscope through the mouth, and there is a sewing machine, and this stitches the stomach inside and makes a big stomach a small stomach. So with these stitches being in the stomach, the intake is going to come down, and this restricted food and feeling full with very little food causes a lot of weight loss. There is also a lot of hormonal changes once we reduce the stomach capacity, which also helps in weight loss. When even this does not work out, that is when we get into something called bariatric surgery. Barios is weight, bariatric is something that is for weight loss. So today, laparoscopic surgery is used to give long-term weight loss. Somebody who's very heavy can lose weight in 6 to 9 months gradually and come back to almost his ideal weight. And this surgery is being done from 1991. So we already have seen this surgery for almost 32 years being done by laparoscopic surgery. Somebody undergoes surgery today, he stays in the hospital tomorrow, day after he goes home. And in 6 months, people do not recognize him if he has been morbidly obese. He loses a whole lot of weight and loses a lot of comorbidities. The significant one is diabetes. Most patients, they lose diabetes much faster than they lose weight. If they are operated today, from tomorrow they may not require any tablets or insulin. Almost 95% of patients stop medicines the very next day after surgery. They get out of their obstructive sleep apnea, they are able to breathe well, they don't need a CPAP machine, they can avoid knee replacements, they can avoid spinal surgery because of slip discs, and all this is because they lose a significant weight within the next few months. There are a whole lot of things that they gain, including their mental makeup. They are much more confident, they lose their depression, they have a good self-esteem once they have lost weight, and they see a whole lot of people around them appreciating them. They look good, they look smart, and definitely they have a different life altogether. So I think there is a whole lot of things for us based on our expectations, based on our weight. We can use what we want today, and there is definitely a definitive way of losing weight. And with all this technology, we can actually fulfill our promises in 2023. Thank you.